Hi guys, this is your host Muskan and I'm very happy to be here with you all today. So this is another session of our show Sugar Smart, and today we will be talking about some tips to take care of your eyes if you have diabetes. So for the same, today we have Dr. Ashish Markan with us. He's an MBBA MD AIMS, is a vitreoretina and uvea specialist currently practicing at I7 hospitals in New Delhi. He has a specialization with an MCH in vitreoretina from PGIMER, Chandigarh, with 10 years of experience in ophthalmic surgeries and 6 years dedicated in vitrio training. He has an extensive list of publications and training. I will just invite the guest. Okay. Hello everybody. Thank you so much for joining in. Hi, Dr. Ashish. How are you?
Hi, Mehak. How are you? Muskan,
All,
sorry.
all
So
good.
sorry, I am late to the session because I think there was some miscommunication. I thought the session was about to start at 8:30.
Okay. No worries, no worries. Hope everything is fine.
Yeah. Everything,
Okay,
everything
perfect.
was fine. I was in gym actually, and then I
Okay,
had to rush back.
perfect. Okay, so
No issue, no
I
issue.
have
Yeah,
already given your introduction. Let's just dive into the
yeah,
session, right?
yeah. Sure.
Okay, perfect. So first question would be, so how does controlling blood sugar levels contribute to eye health in diabetes management?
So as I already told you, the diabetes can affect multiple organs in the body. One of
Yeah.
them is the eyes, and primarily in eyes, it causes diabetic retinopathy. So the longer the duration of diabetes is, more are the chances that the patient will develop diabetic retinopathy, and more will be the severity of this diabetic retinopathy. So we can actually grade diabetic retinopathy from mild to moderate to severe to very severe and to a proliferative stage of diabetic retinopathy. So if a patient has a very uncontrolled blood sugar levels or has a very poor metabolic control, so in those cases, the diabetic retinopathy is comes in a very advanced form and sometimes can be visual threatening.
Okay.
Yeah.
Okay, perfect. So the next question will be, how do high blood pressure and cholesterol affect the eyes, and what strategies can help keep them levels in check?
So you see, apart from diabetes, some other metabolic issues like blood pressures or cholesterol levels, they can also affect the eyes. Not only can they increase the severity of diabetic retinopathy, hypertension itself can cause various problems in the eye, and one of them is causing retinal vein occlusions. So basically, our retina has various blood vessels. It has this blood supply, and if a patient has hypertension or has a very chronic type of hypertension, or the hypertension is too much, in those cases, the veins they tend to occlude. There's a blockade in the veins, which is known as branch retinal vein occlusion or central retinal vein occlusion. And then this can cause some swelling in the retina, which is known as macular edema. And these patients might require a very prolonged treatment in form of anti-VEGF injections. So yes, hypertension, cholesterol, all of these can actually cause vein occlusion in your eyes. It is something like atherosclerosis or blockade. If there's a blockade in the heart, it causes myocardial infarction. If there's a blockade in the brain, it causes stroke. Similarly, if there's a blockade in the eyes, it will cause vein occlusion. So you can just understand this thing by comparing it with what happens in the heart or in the brain.
Okay, perfect. So, does any physical activity help in betterment of the eye health? And are there any specific exercises that you prefer for a diabetic patient?
See, there are no eye exercises. So if you ask me that can some eye exercises help me improve the diabetic retinopathy, my answer will be no. There is no there is no exercise which can actually improve your retinal conditions. But yeah, if otherwise you have a very good lifestyle, you have a good physical activities in your life, and you basically your metabolic control is good, plus you have a good physical activities, that would overall improve your health. Not only the ocular health, but overall your bodily health will be improved. It will improve your circulation to the retina, will improve your circulation to the other parts of the eye, other parts of the body. But yeah, there is no particular exercise which can actually improve your vision, or it can correct the diabetic retinopathy.
Okay. And what about the some lifestyle changes like smoking or alcohol? Does it impact our eyes?
Yeah, Definitely, smoking and alcohol intake can definitely affect your vision. So there is a so if you're talking about diabetes, so if you have diabetes plus you're also smoking and you have a good intake of alcohol, that would actually increase the progression of diabetic retinopathy. Smoking has been shown to increase the progression of diabetic retinopathy. Apart from that, if you are not diabetic, otherwise also smoking is harmful. Smoking can cause these vein occlusions. Smoking can cause optic neuropathies. So by optic neuropathy, I mean that there is this optic nerve in the eye which causes the conduction from the light which comes and falls onto the retina into the from the retina to the brain. So there is this connection between the brain and the eye through the optic nerve. So if the patient is persistent smoker or a chain smoker, these patients can develop optic neuropathy. Similarly, patients of high alcohol abuse, they can also develop this irreversible loss of vision due to this optic nerve damage. So yeah, all of these things: smoking, alcohol intake, hypertension, hypercholesteremias, diabetes, all of them can actually affect your vision and can cause a permanent loss of vision in your eyes.
Okay. Okay, so the next question will be, are there any specific kind of sunglasses or maybe eye protections that are recommended, and how can they help in preventing eye complications?
See, as such, there are no sunglasses or there are no eyewears which can actually prevent a disease in your eye. The only thing is, if you are using sunglasses which are UV protected, they can protect you from some of the degenerative long-term changes which can happen in your eye. So, what can a UV ray cause in your eye? So, it will not be like, yeah, you have a single exposure of a UV light and you develop some complication in the eye. That is not going to happen. It is basically years and years of exposure, a long-term exposure to UV rays. Something like you can develop some external complications in your eye, like we call them pterygium. These are some abnormal growths on the cornea. Similarly, you can develop cataract. You can develop age-related macular degeneration. So some of these degenerative changes which happen with age. So if you have a very chronic exposure to UV radiations, these changes can progress really fast and can happen at an early age. So yeah, using sunglasses which can actually protect you from UV lights is helpful. But yeah, there's nothing which can actually reverse something or can basically help in diabetic retinopathy. If we are talking about diabetic retinopathy, there are no sunglasses which can protect you. But yeah, sunglasses overall can protect you from UV light, and that can protect you from some of the damaging or degenerative changes which can happen with age.
Okay, okay, got it. So the next question will be, are there any warning signs such as changes in vision or discomfort that may, give us an urgent visit to an eye doctor? And how often should an individual go and visit their eye doctor if they have diabetes?
So is it in context with diabetic retinopathy or per se normally?
In context with diabetic retinopathy.
So can you just repeat your question? I just skipped it.
Sure, sure. Are there any signs, any warning signs
Okay,
such as
so see, yeah, these patients of diabetic retinopathy, if they have some of the visual complaints, like what can a patient of diabetic retinopathy present to us? And when we see them, we find them, yeah, they have these findings of diabetic retinopathy. So first is they can develop a sudden loss of vision. So suddenly the patient will come to me and will say that there's a total blackout in one of the eye.
okay.
That means the patient might have developed a vitreous hemorrhage or a retinal detachment due to diabetes. These patients can suddenly they'll get up a fine morning and they'll suddenly present with loss of vision in one of the eye, or they can have these floaters moving around. So those floaters are actually the vitreous hemorrhage. That is actually the blood which is floating in the eye because of diabetes. So diabetes can cause bleeding in the eye, and patient will perceive it as floaters. So not every floater is due to vitreous hemorrhage, but yeah, these patients of diabetic retinopathy, if they develop floaters, that means they might have developed a bleeding in the eye, which is known as vitreous hemorrhage. So if they develop a sudden loss of vision, that could be due to a very dense vitreous hemorrhage. That could be due to development of retinal detachment. And otherwise, these patients can have a gradual loss of vision. So not that they will develop it suddenly, but these patients can actually complain that from last 6 months, from last 1 year, there is this progressive deterioration of vision which has been happening. And they might develop scotomas. So by scotomas, we mean black spots in the visual field. So if I see something, I see it very clearly. But some of these patients, they can see some black patches in their vision. So these black patches can actually suggest that there is some swelling happening in the retina, which is known as diabetic macular edema. So these are some of the symptoms with which these patients of diabetic retinopathy present to us, and they should be aware of them. So if they develop a gradual loss of vision, they develop a sudden loss of vision, or they develop these scotomas, they develop photopsias. By photopsia, we means that they will suddenly develop some light, flickering of light in their eye. All of these are signs that yeah, something is happening in the retina.
Okay. Okay. So
Yeah.
if anybody who has diabetes and is facing any such issue, so we would request you to please go and see your
Yeah,
doctor. Perfect.
definitely. And talking about the follow up, these patients should follow up very on a very strict basis. So depending upon the grading of the retinopathy, we have a follow up schedule for these patients. So if a patient comes to me today and he has a very mild form of diabetic retinopathy, I'll just tell him that you see me after every 1 year or maybe after every 6 months if there is no sign of diabetic macular edema or loss of vision. If some of these patients they develop diabetic macular edema, I would love to see them every 1 monthly. If they have a very severe form of a disease, we might call them little more earlier. If they have a milder form, we call them every 3 months. So it is very important if your treating physician is calling you at a particular period of time, you must follow up at that particular time. You should not delay your follow up because what will happen is if you delay it, the background retinopathy might keep increasing in your eye, and a stage might come where the loss or the damage is irreversible. So it is very important for all these patients of diabetic retinopathy that they should actually come and show whenever they have been asked to.
Okay. Okay.
Hmm.
Coming on to last question for the session, are there any advancements in technology or treatments that individuals with diabetes should be aware of to manage or prevent any eye complications?
So I think there are a hell lot of technological advancements which have happened right now in last 10 years. So you see, we have developed various non-invasive as well as invasive imaging modalities. So by invasive and non-invasive, I mean that for invasive, you need to enter inside the body, you need to puncture the blood vessels, you need to inject something in the your blood and then do some imaging. That is known as invasive imaging. And then there's another modality which is known as non-invasive imaging, where the patient just sits comfortably near a camera and we take some pictures and it will scan the posterior part of the eye, that is the retina. So in non-invasive imaging modalities, we have OCT. OCT is something like a CT scan. So it is known as optical coherence tomography. So the CT scan is like we day in and day out patients get CT scan of the chest, CT scan of the head. That is just the that is just the CT. So by OCT we mean an optical CT. So that is an optical tomography of the eye where we can actually visualize layer by layer of the retina. So layer by layer, we can actually see what is happening in the retinal layers. So if these patients, they have diabetic macular edema, we can pick them on OCT. Similarly, we have another non-invasive imaging, which is known as OCT angiography. So OCT is basically a structural scan. So, and I think these are very technical terms, and even you might not be understanding them, but I think it is important for the patients to know that we have these technological advancements. In non-invasive, the other one is the OCT angiography. So what happens is this diabetes, there are these abnormal blood vessels which are developed in the retina, which actually cause bleeding. So now to detect these blood vessels, we need to do an angiography. So angiography can either be done in an invasive way or a non-invasive way. So by invasive way, we'll have to inject a dye inside the blood vessels, which is known as fluorescein angiography, which is very commonly done in patients of diabetic retinopathy. If a patient is not willing to get a dye injected and does not want a fluorescein angiography, in those patients we can do a non-invasive type of an angiography, which is OCT angiography. So these are some of the modalities which we keep doing in our patients in our clinics of diabetes, diabetic retinopathy, to detect various type of complications which can develop. So the three imaging modalities which are important are the OCT angiography, and fluorescein angiography. So I think these are the three tests which we do them day in and day out for all our patients, and they're a boon for our medical practice. And it has actually changed the way we treat these patients and the way they were treated 10 years back.
That's wonderful. So the best suggestion here we can give you all the audience is just if you're facing anything, you can go and see your doctor first, and whatever technology you guys use, you can help them with that, right?
Yeah. And stop going to quacks or babas. That is my humble request to all these patients, because we see these patients every day.
Mm-hmm.
They have been getting treated somewhere, I don't know where, but from last 5 years, 10 years, and the sugar levels or the blood pressures are totally uncontrolled. and they are not aware of their disease properly. They have not been educated properly, and I think you have a very great platform. And I think all of us should be aware, and it is our because India is right now diabetic capital of the world. So India is the only country in the world with where every third citizen is a diabetic. So one in third person, and out of these, one in third is diabetic, and about 10 to 15% of them will develop diabetic retinopathy over a period of next 5 to 10 years. So 10 to 15% is a very large number. It is a very large number. So if I have an OPD of 60 patients, out of them 20 will be patients of diabetic retinopathy, which I am seeing every day. So right now, there is an epidemic of diabetic retinopathy which is happening in India, and it is very important for these patients of diabetes to be aware of the complications which can happen due to diabetes. It could be diabetic retinopathy, it could be diabetic neuropathy, it could be diabetic nephropathy. So nephropathy means there's a damage to the kidney, there's damage to the nerves. So similarly, there's damage to the retina, which is known as retinopathy. And I think it is high time that all these patients should get aware of the disease and about the complications which can happen in long term.
Absolutely, absolutely. Thank you so much. Okay, so we have 2 or maybe 3 questions in the comment section below. A person is asking, can you use lenses if he has diabetes? Does it have any side effects?
No, I think you can use contact lenses. There's no problem if you maintain a proper hygiene and you have a good hygiene per se. And I think there's not an issue. Yeah, if you develop some abrasions in your cornea or you have some healing problem, in those cases, if contact lens is causing some damage, then you should avoid it. But otherwise, there's no contraindication in diabetic patients that they should not use contact lenses. There's nothing like that.
Okay, there's one more question. A person is asking that he has a bright spot moving in peripheral of his eye, so which move in arc fashion and suddenly disappeared. I am. I don't think so. Okay, can you please shoot in the question once again if you're here? Apart from that, that's all. I guess we don't have anything else in the comment section. That's all, I guess, Dr. Ashish. Thank you so much for.
Thank you so much. Thank you. And so sorry I was unable to join at the time because I was not aware actually. And I don't know why I just felt it was 8:30 and I planned it accordingly.
No worries, it's okay. It's okay. Thank you so much for joining in. I would also thank all the audience to join in, and thank you so much for making this session so informative, Dr. Ashish.
Thank you so
Before
much.
ending this, I'd just like to tell everybody that we also have a diabetic community on our WhatsApp channel wherein you can join in, and there are also people who have been suffering from diabetes, or maybe who can help you out with everything. And for the same, we have the link in a bio, and in case if you don't find it, you can just drop a message in our you can drop a message on the same ID, and we'll definitely share the link to the same. Thank you so much, Dr. Ashish. It was a lovely session.
Thank you so much. Thank you.
So much,
Nice talking.
guys. Bye bye.
Bye bye.